Chain Drug Review and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello, everyone. I'm Jeffrey Wolt, Editor-in-Chief of Chain Drug Review and Mass Market Retailers. Welcome to a special edition of our video forum. Today, we're going to bring you some of the highlights from the recent Health Equity Summit, co-sponsored by Chain Drug Review and Kearney. We'll begin with a few remarks from Dominique Harris, a partner in Kearney, who served as the host for the day, and follow that with part of the keynote speech from Kristin Williams, Executive Vice President and Chief Health Strategy and Policy Officer at Hy-Vee.
You know, we have this summit because we want to bring together a number of companies and organizations, I would say industry experts, really to talk about how can we start to advance the problem of our health disparities? How can we start to work to figure out solutions? And it's not just about companies and organizations, but also institutions, right? And so we have a number of local community members here from Chicago in the room today. So we're hoping that today we can foster true discussion on what are we doing right now to work through health disparities, but what can we continue to do, and what new ideas do we have that we could bring back to our teams? This topic, this problem is not just about the business aspect, it's personal. I know many of you in this room either have experienced it yourselves, either your friends or your family members. If I think back to 4 years ago, I had a cousin who was a first-time mom, and she was having contractions. She was timing her contractions with her husband, and they were getting down to about a minute long every 4 to 5 minutes for the last hour. So she's like, okay, I need to go to the hospital. So she goes to the hospital, and they're saying, well, you're only 2 centimeters dilated, so you should go home. And so she was like, what? I'm a first-time mom. How do I count how many centimeters I am? I don't have a doula or a midwife or anything. But they're like, no, go home. So she went home, and in less than 4 hours of getting home, she had a number of more contractions, a lot more pain, and her husband called 911, but it was too late for the ambulance to come, and she had to hop in the tub. And she had the baby right away. Luckily, she caught the baby as it came out. You could Google it. It became national news. And the baby's healthy. She's healthy. And it turned out well. So I'm telling the story because it turned out well. But unfortunately, in many cases, that's not happening. And I know we'll have a women's health panel later today. I tell that story because last year I told a personal story about myself, but I wanted to start out with something personal because this is personal, right? It's affecting lives every day.
I started working for Hy-Vee when I was 14, and we really reflect the communities that we serve. We serve a lot of different communities, and we're doing some great things in the health and wellness space, so I'm excited to share that with you today. I hope this really spurs others into action, because really doing nothing is not an option. We at Hy-Vee are the lifeblood of the communities that we serve. I believe it is the role of organizations to elevate, sustain, and cultivate our communities. So White House Conference on Hunger, Nutrition, and Health. So on our ongoing commitment to fight hunger, we've made great progress in addressing insecurity over the past several years. We were one of the select retailers to attend the 2022 White House Conference on Hunger, Nutrition, and Health, hosted by President Biden. At this conference, we committed to delivering 30 million meals to vulnerable communities by 2025, and we are deploying our registered dietitians to educate 100,000 Americans in areas of low food access on healthy eating and nutrition by 2026. So making healthcare accessible beyond the brick and mortar pharmacy, for those of you that don't know, we have about 285 retail pharmacies located within our stores, and we also have clinics in some towns where we actually don't have Hy-Vee stores. My other job of what I do on the side is I'm also our president of our Amber Specialty Pharmacy that has 19 locations located throughout the country. And so we wanted to make access to communities that we didn't have pharmacies in easy. And so we launched our mobile fleet. So we provide immunizations and health screenings to patients outside of our retail stores. We have 19 Hy-Vee Health trailers and 9 Hy-Vee Health U-mobiles. And those are deployed to the communities that we're serving. And so we're really only one of a few retailers in the nation who operate our own mobile fleet. And so it allows us to go into communities where they don't have access. We have a chain of stores called Dollar Fresh. Some of those do not have pharmacies in them, so we're able to bring those mobile clinics there. do biometric screenings that some of our supplier partners pay for, and then also are able to give vaccinations off those as well. And then moving forward, we're an employee-owned company, so we're a self-insured company. We have over 25,000 people on our benefit plan. So we always look to ways to make their lives easier, healthier, and happier. So one way we're doing this, we launched affordable infusion therapy. We hired a chief medical officer about 2 years ago. And so we're diving into physician-led practices, not only in the pharmacy space, but now we're diving in, as you see many retailers do, launching more physician-led practices. And the first step of us doing this is diving into affordable infusion therapy. So we actually have a site here, an Amber Specialty Pharmacy site here in Chicago. And then we also partner, now we have a ambulatory infusion site here as well, just right off the Miracle Mile. We knew that there wasn't a lot of access in downtown Chicago, so it allowed us to really try a different way to serve the communities and doing it in a different manner than the traditional pharmacy model that we had before. So we have a virtual dietitian program. We were one of the first companies in the country to launch dietitians in our stores. We were the largest employer of dietitians. With COVID, we now have a telehealth option with that. And so we're diving into medical nutrition therapy. And one large university in our state, they only employ 2 dietitians. So as those people are diagnosed with different disease states, we know that they need specifically tailored meals. And so how do we help solve that problem? We're launching dietitian hubs in order to help them. Same on the specialty pharmacy front, right? People are faced with needing to eat a specific diet, and so we have embedded in our teams, depending on that drug or specific limited distribution or that disease state that the patient has, we're able to then give them good consult of how they lead healthier lives with good food choices. Within our retail pharmacies, we've added several new services to increase access to care. We launched free talking prescription labels at all of our pharmacies, so that was good. And then also we launched the hearing aids as well. And so mental health coming out of COVID has been another big focus, including the launch of new products and a new division, which was Redbox RX. So Redbox RX, we're able to ship prescriptions straight to your door. It's a telehealth option. And so we launched this as a lifestyle pharmacy. And so lifestyle pharmacy like Romans and Hims and Hers. But we really also had a play in the mental health too. And so we have noticed it's not a lifestyle pharmacy. What's most widely used is our mental health services. So people are able to have a consult, and then we're able to get them the medication that they need from a mental health perspective. And so that was really interesting for us. Hy-Vee is a founding partner of the nonprofit Healthiest State Initiative, and this helps Iowans live their healthiest lives. So one of our key programs from the Healthiest State Initiative is the Prescription Produce Program targeting unmanaged diabetes and uncontrolled hypertension. So we currently partner with Broadlawns Medical Center for both adult and pediatrics. We've impacted 250 individuals from these 3 sites so far, and we're going to expand this to 5 more sites as well. And so physician distributes a voucher to those eligible patients. Really, they're low-income diabetic patients. It's how they qualify, and it's funded through the USDA grant. And then the redemption rate, so some of the KPIs behind this are redemption rate incentives, distributed versus redeemed for produce. So they get this voucher, they come into our stores, and they get free produce. And then they go back into the office with their visits, they determine if their numbers are getting better. And so for 2023, the goal is 90% of redemption, and we're on track for that target. We're a little bit over 80%, and that's just redeemed at those locations through the end of August, so those numbers are constantly increasing. So we have a program with the Healthiest State Initiative. They were called the Healthy Checkout Lanes. And so these were the ones that we knew that the parents could take their kids through that had just healthier for you options on either side. It wasn't for all, right, because we still have a freedom of choice, right? We still want to be a good supplier partner, but we knew taking kids through these specific aisles, they wouldn't be asking for that candy at that eye level. And so that's one of the examples that we made some changes to do that. We operate in Iowa, and then, like I said, around the several states that touch Iowa from a retail pharmacy perspective. Sometimes we are the only healthcare provider in that town. Our towns are shrinking, definitely from a rural perspective, and so physician practices are not there. There's a shortage of primary care providers, and so our longest tenured position in Hy-Vee is our pharmacy manager. And so with that, we know that they are a leader of the community. We know that they are the face of the community too. People come in, they trust them, and it really, it bodes well for, one, of course, the brand, but then just being able to help, being a pharmacist myself, for those of you that didn't know that, it just, it gives you a sense of purpose, and our pharmacists definitely have that. We also pride ourselves too. We opened micro-fulfillment centers across our territory. And so that was one of my first jobs about 10 years ago. So micro-fulfillment fills the prescription off-site, sends it back to the store. And so instead of me sitting there counting by fives, my head's down, I'm able to talk to more patients because I'm offsetting that manual labor. Prescription comes back within that same day, so there's not any patient disruption. And so our pharmacists are able to practice at the top of their license. They're able to do other things for the communities that maybe others don't have enough time for, so we bought them time with that. And so then that allows us to do those pilot programs like a test and treat, to do flu and strep testing, to do other things with our regional partners, knowing where that there might be a need. To recap the key learnings from my journey, I'll leave you with 3 key success factors to support health equity. 1, listen to the communities you serve to guide your investments. Collaborate to drive greater impact. No one can do it alone. Learn from the successes and failures alike. Stay committed to bold moves. And so let's use the time today to get to know one another, hear from our community leaders and doctors, ask questions, share our successes and failures, and come away with new partners and allies in the fight for health equity.
Kristin's last point is well taken, and we'll spend quite a bit of time in coming weeks exploring how healthcare stakeholders can do more to advance the cause of health equity.